Swadikap and good afternoon once again. Saturday, 8th of May 2021. I'd like to start off first with an issue to get it out of the way. It's very important as well. It concerns the understanding of a news report in terms of foreign embassies and the foreign nationals here. So there had been a media outlet that had erroneously reported that foreign embassies in Thailand can make vaccines available to their nationals. So we would like to reiterate that foreign nationals, expats, diplomats, everyone working here, as well as all other people living in Thailand are included in the national vaccine rollout plan. And COVID vaccines will be made available to them through the second phase of the plan, starting from June until the end of this year. So I've been asked to clarify this, for people not to contact their embassies and expect to receive a vaccine rollout from the embassies itself. So as far as we know, that's not true. That's not happening right now. Dr. Pisamai gave us very important information. One was about Bangkok, the situation in Bangkok. Now, in Bangkok right now, with the many clusters, risk clusters, the mild symptoms group and the asymptomatic group in Bangkok is quite high, quite higher than the severe patients group. So that's the highest prevalence of COVID in Bangkok, so the mild and asymptomatic group. Now, two things are being done. Firstly, of course, is that vaccine rollouts in terms of emergency rollout will be allocated to Bangkok Metropolitan Administration staff, especially those who work in the public transportation sector, buses, boats, and everybody who works for the public actually and is under the BMA. Another part of it is about active case finding. Now you know about the Klong Toey district cluster. So Klong Toey district and various clusters and various districts in that area. So we are conducting strong active case finding in those districts. Sort of like we go where the flame is. We follow where the flame is and we try to put it out as soon as possible. So I'll move on to the number of cases recorded for today. 2,419 new confirmed case. Just mind you that today we have new recoveries at 2,247. So if you do the math, actually around 200 new cases are placed into the system today because 2004 new cases, but 2002 plus of new recoveries. So around 200 more cases added to the group. Now out of this new confirmed case, 2,419, we have most of them from local transmission and active case finding and only 10 from within the state quarantine system. Active cases, as you see in the dark green box on screen, currently being untreated, is 29,473. Out of this number, 1,138 are cases of critical condition, and out of that number, 380 are those on ventilators. Unfortunately, we have 19 new fatalities recorded, making the cumulative 382. 8 male, 11 female in this group of fatalities. Age range is 42 to 93. Once again, the elderly, this affects the elderly. And the median age is 68. In terms of provinces, fatalities, we have 7 in Bangkok, 2 each from Samut Prakan and Pathum Thani. And the other provinces, we have 1 each. 9 fatalities were those in close contact with family members, 3 with confirmed cases, 2 close contact with friends, and 3 visited crowded areas, especially malls. Now, today, the province with the highest new confirmed case is, of course, Bangkok and Nonthaburi, and you see some of that detail on screen in terms of the provincial breakdown. We also have a chart, I believe, regarding the districts in Bangkok as well, the number of cases in Bangkok districts. So many of the confirmed cases have been reported that they have been to markets and have used public transportation. So This proves that infections are coming from these two particular areas. And local authorities and factory owners have been asked to be more vigilant in monitoring migrants as well in the area, as a large number of workers, migrants from neighboring countries, have been found to enter Thailand illegally during these days through the natural borders. Now, talking about Bangkok again and the peripheral areas, having the highest number of confirmed cases every day, with confirmed case standing at 1,641 today in Bangkok. Now, active case findings in these areas have been beefed up to stem the spread of virus. However, the clusters in Bangkok under surveillance include Prom Prap, Satru Pai, Dusit, Pranakon districts, and other districts as well. Now, there are more active case findings that will be carried out in the risk areas and infected clusters today. The CCSA asking for everyone's cooperation so that this mission can be successful. There will also be the opening up of a new field hospital called Budsarakam Hospital, opened at IMPACT Muang Thong Thani, the Challenger Hall there. It's an exhibition hall, if you're familiar. So that will become a field hospital to cater to patients infected with COVID in the area. Additional information, the Bangkok Metropolitan Administration has extended the temporary closure of premises. As the number of confirmed cases in Bangkok is still high, the BMA decided to stem the outbreak by extending the temporary closure of certain premises until May the 17th. Now, these affected by the order include schools, and you have that order on screen, but the font might be too small. But schools, entertainment venues, public parks, and while shopping malls can open until 9 p.m. and convenience stores until 10 p.m. So this is an extension of the closures of various places. Also, for those fully recovered patients, if you wish to donate blood plasma, the Thai Red Cross is in need of this. For those who are fully recovered patients and wondering how they can help, the Thai Red Cross urging fully recovered patients to donate blood plasma, which contains antibodies that can be used as the key component to treat COVID patients with severe conditions. And plasma treatment in life-threatening cases also show a higher percentage of recovery. More plasma donations means the survival rate will be higher in Thailand. As you see from the infographic on screen, qualified donors must be fully recovered and have been discharged from hospital and complete the self-quarantine at home for 14 days. And for more information, you can look at the contact numbers on screen. One good piece of information is about the vaccine vision, the vaccine supply of Thailand, where the Prime Minister ordered a large number of additional doses of vaccines. Now, as I mentioned earlier, that there are 2.5 million doses of vaccines set to arrive this month. The Public Health Ministry also confirmed that there will be 10 to 20 million doses of Pfizer vaccines delivered to Thailand in the latter half of this year. And the Prime Minister also planned to order another up to 200 million doses within the year to ensure that there are enough vaccines for everyone on Thai soil, with the aim of having 50% of the elderly in the country get the first jab by the end of July. Now, I'm talking about 50% of elderly in that group, not the entire population in terms of the percentage. Now, the vaccines, of course, they will be allocated to Bangkok. If it's talking about the immediate allocation in Bangkok, around half of around 3 million doses for Bangkok because of the cluster and the important clusters that we are facing in Bangkok these days. So the daily CCSA meeting this morning discussed many important issues. One question that was posed was about the authenticity of the numbers that we present, to assure you that we present you with the facts. The numbers are not hidden anywhere. Now, if the numbers are around 1,000 or 2,000 per day, it is also because of the active case finding missions that we have been conducting in many areas, particularly in Bangkok. Now, when we have around 1,000 plus, 1,100 plus cases in critical condition, Dr. Apisamai reaffirmed that this is a number that is still quite manageable in terms of the critical condition patients that we have. Out of around 2,000 plus per day, right now currently 1,000 plus critical condition. So quite manageable. And before ending, I'd just like to reiterate the importance of contact tracing. The number of confirmed cases rising steadily, but manageable, hopefully. We cannot overlook the issue about contact tracing, how we can curb transmission. So in the infographic, credit to the World Health Organization shown here, if you've been confirmed to be infected, it's best for you to provide all the details of where you have been, the timeline to health authorities. That's very, very important so that they will be able to trace and identify people that you know, that you have met, who might be at risk in contracting the disease as well. So like I've mentioned before, to prevent the further outbreak, the responsibility starts with you, starts with me, starts with all of us. And to protect others around you, you must first protect yourself. Thank you for your kind attention, and please enjoy the rest of the weekend, and we'll see you again tomorrow. สวัสดีครับ
ขอบคุณนะครับท่านณัฐ